Welcome back. We're continuing the news. In this evening's health report, Shamala Pullen looks at diarrhea.
Diarrhea is the passing of stool or watery stool. It can be uncomfortable and worrying, especially when the cause is unknown or the duration is uncertain. It is very common, affecting people of all ages. Adults typically experience it about once a year, while children may have it around twice a year.
Diarrhea can be caused by viruses, can be caused by bacteria, can also be caused by food intolerances such as lactose intolerance, and there are some diseases which will give you diarrhea as part of it, your Crohn's, your ulcerative colitis. Most are infectious agents, however, which will give rise to the diarrhea.
Acute diarrhea usually lasts 1 to 2 days and often clears up on its own. Persistent diarrhea can last 2 to 4 weeks. Chronic diarrhea lasts more than 4 weeks or keeps recurring, and it may require medical attention. Treatment focuses on preventing dehydration and easing symptoms.
One of the huge expectations I find for patients is that they're looking for antibiotics to treat the diarrhea. Most diarrheas do not need antibiotic therapy, and in fact, for the most part, we'd advise against it. Also, the use of medication to form up the stool. There are commercially available tablets which can do this. These tablets very often give you short-term relief, but actually end up prolonging the diarrhea in the long run and can be dangerous depending on which agent it is that's causing the diarrhea.
You can't always prevent diarrhea, but you can always lower your risk by staying hydrated and avoiding infections and contaminated food.
Home remedy really involves rehydration. So that's fluid, any kind of fluid, water, coconut water, electrolyte solutions. You get those commercially over the counter, and there are a couple sports drinks which have electrolytes in it. They're not specifically for diarrhea, but they can be used. You want to have light meals, so like biscuits, crackers, toast. Bananas are good. Applesauce for those who have access to it.
With your health report, I'm Shamala Pullen wishing you good health.